Is staying connected with you. So I hope to chat with you guys afterwards and hear where you are. I was on the phone last night, like literally at 7 o'clock at night with Calvin Poon. We're talking about getting him involved in a video. I had an email conversation with Sarah Johnson yesterday about a paper we're writing together. So lots of continued conversation with you. And I meet a number of you at conferences, and we really do love hearing what you're up to. And also feel free just to get involved. Lots of opportunities. FENS work, for example, as we are doing research. We always need people to take our CE programs, participate in research, to come back and do some teaching, to involve our school in some of your initiatives through your workplace. So if you see rules for us, please, we'd love to be involved. And what I'm actually going to talk about today is a shot in the arm, is the immunization program that really is about, our research is about measuring how you are doing, or what is the success of that program out there. So first of all, how many people in the room have immunized over the last couple of years? All right, okay, so this talk is about you. It will be about everybody else too, in a few of the slides as well, you'll see. So the question, first of all, is what are the targets of this program, and did we achieve them? So the first thing is, what were the targets? Did the government actually decide we want to make sure that immunization rates increase by a certain percent or anything like that? There really isn't a lot of information out there. So we're going to talk a bit about what would reasonable targets be for immunization, what our research data tells us, and then also what additional research we may be interested in doing next. A lot of different researchers. Some of those names you'll recognize. The three in blue across the top are the co-leads of the program. So Sherilyn and I are currently the co-leads. And you remember Eric Schneider, many of you from our classroom. As well, you'll see a couple of students' names. So students that were involved on co-op, on independent study, and continue to be involved in our group. Our funding is from the Ontario government predominantly, and that's how OPEN started, but also the Neighbourhood Pharmacy Association funded the economic study that I'll talk to you about very quickly. What I'm not going to talk a lot about is methods, not really all that interesting, but just let's say there's a lot of different types of studies done, everything from surveys to large administrative data sets looking at like 3 million patients, and you'll see how that data, you'll probably understand where the sources are as we go through, but I won't talk about that in a lot of detail. So I put down what I thought were 5 reasonable targets, things that we would think we would want to see with this program. First of all, we want to improve the overall influenza immunization coverage in Ontario. So when the government started this, that was certainly one of their goals, is that we want to make sure that more patients are receiving the vaccine than were before. And the reason for that is that immunization rates have stalled. And in fact, you're going to see some data showing that they've been decreasing over time. And so we knew that the influenza program really needed a sort of a kickstart, and that a pharmacist providing had a lot of advantages, particularly, of course, with respect to access. And so we want to know, did that actually happen? If we are able to immunize more patients, do we actually decrease healthcare costs? Because, of course, that's another important outcome to take a look at. Are patients satisfied with the services? Are pharmacists satisfied with the services? Have they been able to operational to get this going in their clinics, in their community pharmacies, et cetera, and are they satisfied? And then finally, one number that we do have is that the Public Health Agency of Canada tells us that anybody who is immunizing as a healthcare provider needs to get the flu vaccine themselves. So are we achieving that from a pharmacy perspective? Because we haven't ever been measured before. And for those pharmacists who are not immunizing, so there was a few individuals in the room, 80% of those individuals need to be immunized, because it's still about protecting the patients that you're in contact with. So let's talk about those different areas and see if we have any numbers to help us understand what's happened. This is looking at physician and pharmacist billing over a long period of time. So all the light gray bars that you see over the last about 10, 12 years are the physician billing. And you'll see that downward trend over the last 10 years that I was talking about. But what you'll see in the last 2 years, and I have data up to 2013-14 on this slide, you'll see that that began to reverse. And so we began to see an increase. So this was very good news to see. But is the only place you can get vaccinated physician offices in pharmacies? No, there's other sites. So we had to take a look at that data as well. So this slide illustrates that. So the first, the one on the left is the pre-pharmacist season, and the one on the right is 2 years later. So we know those numbers have even changed since then. And what you'll see is the bottom three colors are physician, public health, workplace settings, and you'll see generally all of those numbers decreased a little bit. So one of the questions that people said to me is, you know what, I think pharmacists are doing a great job, but basically we just shut down public health clinics, physicians do it less now, so you're just picking up that leftover. So have we really increased that total number or not? And so when you take a look over there on the right side, you'll see that this number still is higher. In actual fact, we increased the number of patients who were immunized in the province by about 450,000, and that was a couple of years ago. So we know that number has probably increased even more. So this was a very good news story. Oh, sorry, and if you look at the very top right corner, that's about 3% of the population. Now I have to say, I was actually hoping we'd have this like 20% increase in flu vaccination. And I'm going to tell you these numbers are really, really hard to move. And we're going to talk about why that is in a few minutes and some of the things that we're hearing from pharmacists and patients that come into pharmacies about things that we may have to deal with to really see bigger changes in that. But 3% is not bad, actually. That's a fairly significant, clinically significant change. I wish it would be higher, and I will be continuing to look at this data because I think the numbers will actually increase as we've vaccinated more and more patients every year. Well, the other question about coverage is who is getting vaccinated. So we took a look at those 3 million patients and we said, how can we predict basically who's getting immunized by a pharmacist and by a physician? So what you'll see there is that you are more likely to be immunized by a pharmacist if you are younger, you live in a higher income neighborhood. If you're an immigrant, you're more likely to be immunized by a physician. If you have chronic diseases, diabetes, hypertension, you're more likely to be immunized by a physician. So if you take a look at all of that, you kind of say, well, it sort of looks like if you're older, have chronic diseases, immigrant, and there was a few other things in terms of hospitalized in the past year, you're more likely to be going to your doctor's office anyhow, you're getting your vaccination there. And for many people, especially seniors, we heard a lot, I've done that every year, I make an appointment, it's a standing appointment, I go in and I get it. Whereas who's getting vaccinated by a pharmacist are younger, healthier, wealthier patients. And why? They're busy, they're working. So this is the convenience factor in the access. And so we're getting to that group. One of the things that I kind of thought, they're not as high risk. Is that as good as what I had hoped? But they're also a really hard group to get immunized because they're busy. And who do they look after? They look after children, elder care. So they're actually a really important group for us to be immunizing, and a group that has been very hard for any other group to target. So I think this is actually a good news story. The other thing that we saw was that if you had received a service from a pharmacy in the past year, you are more likely to get a flu vaccine. So what people are beginning to do is they see a pharmacy as a healthcare destination, a place I can get care. So I receive services and a number of things. I go back now to get my flu shot. And if you were immunized by a pharmacist, you're 8 times more likely to return to that pharmacist to get your flu shot. So a lot of loyalty is also being developed. So this was very interesting. Yet you are more likely to return to your physician as well, but not nearly as much as the loyalty that we saw with returning to a pharmacy. So this was quite interesting. So target number 1, did we improve overall immunization coverage in Ontario? We did increase those provincial numbers. We are getting to this specific group that was it's harder to target. I think that there is some gaps here. We do know who the high-risk patients are. We can sort by which patients have diabetes, et cetera. So there are some gaps. We could probably target some of those other higher needs and more vulnerable patients as well. And I didn't show this, but we still have a number of pharmacies, a good percentage, that are not immunizing. So there is still more capacity in the system to do that. What about healthcare outcomes then? So what we took a look at is the economic impact of immunizing those patients. I'm not going to get into how you economic model, just to say you put a lot of numbers in, and it's kind of fun, actually. So you put in the cost of vaccinating in a physician's office, and a pharmacy you put in, healthcare costs that are saved if you get the vaccine, and we talk about the vaccine effectiveness, which really has great variability year to year, so how do you factor all of that in? And Sherry Lynn is the lead, so I'm sharing some of the research that she has been leading in this project. You are the third group actually has heard anything about this, so this is really new data. We put all of those things in place. What did it tell us? So it said that when we immunize that additional 450,000 patients, it costs the system $5.7 million to do that because we get paid for that. There's costs that have to be incurred. But we save money in terms of those flu outcomes, so those healthcare, hospitalizations, et cetera, of about 800,000. So, and again, it's a little bit lower because we are a younger, healthier population through pharmacy, and so they're less likely to get sick. But the big difference is those individuals are also the ones more likely to be working. So what happens when you have to go get your flu vaccine at your doctor's office? You have to make an appointment, you have to leave work. What happens when you don't get vaccinated, and you get the flu? What happens? You miss work. So when we factor in the productivity costs, so you can see the time invested to get vaccinated or the time lost that if you were sick, you'll see that is a savings of $7.9 million in the province and a resulting change, if you look at those two things together, where we saved the Ontario, the province, $3 million. So we were showcasing these numbers just the other day to the ministry, to OPA, to Green Shield, a number of different organizations, and they thought this is really one of the first times we've been able to show that the services we provide save the system money. And in fact, one of the things I really liked is it talks about employers. So if you're running a business, so if you run your own community pharmacy, you hire employees, this is the type of thing that's really important to you as well, because getting your team vaccinated can save you money in terms of the productivity, let alone all the other issues of protecting your patients. So did we save the healthcare system money? You just heard the answer to that. One thing we also did is we said, okay, well, let's just say pharmacists couldn't immunize, and we took those 450,000 and we said, okay, physicians, public health units, et cetera, are going to vaccinate those patients. How much would it have cost? What's the difference in terms of pharmacy? It would have cost the system $2.3 million more to have them vaccinated through physicians, public health units, et cetera. So not only are we saving the system money, we're a very cost-effective way of doing that. So some really good news stories there. What about the patients? Patients, we thought we were going to survey patients who got immunized by pharmacists and say, hey, how did that go? But what we decided to do is look at the literature first. I'm going to tell you there's tons of stories. And John Papastergio, I don't know if any of you know, pharmacist in Toronto, he did a great survey of about 1,000 patients and high degree of satisfaction with the service. Incredible. You rarely see studies so consistent. Over 95% of patients said, this was fantastic, I'd return next year, et cetera. So we already kind of knew that information, and we began thinking, well, what do I really want to know? What I really want to know is, okay, I know when you come to me and have the service, you're satisfied, but why did this other person not come to the pharmacy to receive the service? So we wanted to talk to the patients who didn't get immunized by a pharmacist and try and understand why not. So we sat in 6 community pharmacies, basically with iPads and paper in hand, and didn't accost people, but basically once they walked into the pharmacy, so in other words, they can make it to a pharmacy. We know that because they're in the pharmacy now. And we said, would you mind completing a survey? Usually, you can imagine most of us are busy, you walk into a pharmacy, what's your response rate like? 58% of people said yes, they complete the survey. Wow, I was amazed. I wasn't the one, this person I hired, she's going to do all of my recruiting. She was amazing. So, and we did actually have pharmacy students at a couple of the sites who had to take off their coats because we didn't want to be associated with pharmacy, but a number of the pharmacy students helped with that. So it was great. Just to get a sense of who answered the survey, that's important, you can see all of these individuals, the blue lines are how often were they in the pharmacy. These are all people who were in the pharmacy relatively frequently, so they could get the vaccine because they did come in. And if you take a look at the age group, they were generally the age group we know that was getting vaccinated by pharmacists. So, okay, what is going on? Why is it that they're not getting vaccinated? So here's the answers. First of all, a third of them didn't know the pharmacists could vaccinate, so this was news to them. So now, this was a year ago. We certainly know there's lots of billboards. Maybe that's improved. I think it probably has a little bit. But I think we have to remember, some people still don't know that pharmacists can give the vaccine. So I think that's something we have to consider. So then we asked, why didn't you go to a pharmacist? And I want you to look at the red bars in the next 2 slides, okay? Because there's a message here. And the message is 41% said, I don't need the flu shot. So I don't even know. It doesn't really matter. I don't think I'm not likely to get it. I've never had it before. I don't see the value. Whatever. They are not interested in getting the flu shot. And I think the other ones you'll see, the other blue bars just basically say people do get the flu shot elsewhere and they are happy getting to at a physician's office, et cetera. And I'm good with that. One of my things, my points is I don't care where you get the flu shot, get the flu shot. And I'm happy that we find the right place for each person. So the other question we said is what would increase your chances of getting a flu vaccine from a pharmacist? And again, take a look at the red bar, nothing. So bottom line, I'm not interested in getting the flu shot, so that's a group. But I think the other ones are important. Very small percentage said these things, but again, think about it in your own pharmacy. Concerns about privacy, we know sometimes the wait times. I know I went to my pharmacy 3 times before because they didn't have any. So, patients are seeing that sometimes, they have to wait, flexibility, not making an appointment. Those types of things are really important to them, and that they would like to see more of that. The point of this slide is how often did you get the flu shot in the past? Where did you receive it last year? And are you going to get it next year? The bottom line is, again, we saw 30 to 50% of people saying, I'm just not going to get it. So I think this is something that is really important. We call that vaccine hesitancy. There's a lot of reasons why. Some people, we just mentioned, they don't see the value of it. Some people say the match is bad. We know all of the types of things that we hear in our pharmacy. But the question is, how often do you have an answer when those people say, what is your answer? Do you have your elevator pitch ready to help convince them? Because look at the next slide. Oops. Next slide says, we ask the question, if somebody recommended the vaccine to you, how willing would you be to get it? So a healthcare professional says you should get it. How willing? 61% said, oh yeah, I'd get the vaccine. So I think this is a really important space. And what we hear from a lot of pharmacists is, bottom line is, we are so busy right now that when they walk in, if they ask for the flu shot, we give it to them. But we're really not trying to talk to the rest of the patients in our pharmacy about, did you get it? Why not? And so what we're going to be working on now is really quick and snappy answers to the very typical things that you hear. So and there's some great evidence out there, sorry, not evidence, because there's not a lot of studies with it, but there's a lot of different tactics and approaches that we just really haven't talked about in the pharmacy space that much. So that's something that we're going to be working on and working with the Public Health Agency of Canada and the Canadian Public Health Association, who, by the way, are really excited that pharmacists are providing this service and are kind of all over us saying, we kind of feel bad. We never included pharmacy. Just like you're talking about the opioid, everything is sort of geared to physicians, et cetera. So they've said, can you work with us to try and help create resources that are more helpful to pharmacists? So you'll see a little bit more about the vaccine hesitancy as well in the next little while. So the question was high degree of patient satisfaction. I think the answer to that is yes, but I do think there's some other ways that we can be reaching patients in this space that are important for us to consider. What about pharmacists? We surveyed 780 of you. If any of you answered that survey, thank you very much, and said, what's going on? So there were a lot of questions. I'm just going to pull out a couple of them right now. First of all, you said lots of other vaccines are also important, and we think we should be providing those as well. And we know, I sit on the working group with the ministry, there is going to be an announcement this fall, some expansion of those vaccines. We're probably not going to be like a few of the other provinces, which have very open lists, but anyhow, there will be some increases. So we know that, to me, this is sort of good news. It's not like, okay, we gave the flu vaccine and I don't want to give any more. A lot of patients are inquiring and wanting additional vaccines. We feel we should be giving those. This is a summary of the barriers and facilitators, and this is what I wanted to know is, what makes it better for you to be providing the service, what helps you, and what is a barrier. And the first comment I want to make is that if you look at the facilitators at the top, the first two are, why do I do this? I do this for patients, and I do it because it showcases additional roles that pharmacists can play. Those are great reasons. It's not about, I can make more money, this is a really great business opportunity. No, those are there in the list right afterwards, which I think are fair. I think that certainly is part of the reason for providing these services. But I love the fact that the first two really are about the patient. If you look at the barriers at the bottom, the very bottom is the most common. So it's, what am I seeing? It's about workflow, it's operational. It's being able to integrate this into an already busy practice having to take somebody into a private space, take the time to explain, et cetera, and how do you do that with everything else that is going on? And so I think that the operational challenges still are a problem. There's a lot of logistics, professional liability, training, and so on that has to be factored in as well. So that they seem to be very practical issues, and I think they're important to address. I am obviously, either this is sensitive or I'm pressing too hard. We jump all around. I think I have to say from a pharmacist's perspective, one thing we need to step back and say, though, is there are 1 million doses that are given in the province each year so that even though, yes, there's some challenges, the whole core business model and how we operate a pharmacy, this is a service that is highly provided and is done, has been done very well. So I think we should be very proud of the fact that that we are where we're at. And that we do it for the right reason. But I think that there still are, as I mentioned, some of those operational challenges, which I'm sure as we have provided the service year by year, many of those will be ironed out. But we have just done a survey of vaccine distribution because we heard a lot of comments about, well, I'd love to give it, but the vaccine doesn't show up, or I run out and I order it and they tell me it's going to be a week from now, so we could even be providing more, but the vaccine distribution challenge is there. So we're doing some work on that as well. So the last one was that call to arms that we just wrote a paper on it. And the question is, are you guys getting vaccinated? And myself. And the answer is that 7 out of 10 pharmacists are getting vaccinated. And that's actually pretty impressive considering we've only been vaccinating for a couple of years at this point, right? If you take a look at physician and nurse data, it's about 9 out of 10. And it is a little bit different for pharmacists. If you are if you're an immunizer, it's about 8 out of 10, and if you're not immunizing, it's about 6 out of 10 pharmacists. So you're going to actually see, and you may see a few familiar faces from this room. We're doing a Pharmacists Get It campaign with CPHA, and there'll be a little video. And the idea is to encourage pharmacists, for various reasons, to get vaccinated yourself in the upcoming flu season. So it's been interesting. It's a lot of fun. And then we have a couple of our individuals here who help us with all the videotaping and so on, so very much appreciated. So that's where we're at. I think, we were just comparing it to meds checks the other day because we did research in that area. The immunization, very successful. Still some room for tweaks and improving it, and I think room for growth, but generally very well received by the ministry, by the third-party payers and so on are quite interested in this. I think that what we need to tackle next, and some of our research will look at practice change, the challenge of how to operationalize and make this smoother distribution, et cetera. That vaccine hesitancy space, as I mentioned. I think talking about how do we target some of our higher risk patients or vulnerable patients and make sure that they are aware and can get the service through pharmacy. And then I think to continue measuring the healthcare data, just like we did now, and measuring it again a couple of years later to see where we're at. Those are the types of things that we're going to be focusing on. So I mentioned as well the partners and some of the people that are very interested in this and are very interested in you as being a new healthcare provider for them in terms of delivery of public health. So I think you should feel very, very proud of what you have done, and more to come. So any questions? Yes.